A new report shows an increase in computer attacks targeting people's medical records. Pro Tennis, that's a firm that helps healthcare companies protect data, says there were 222 hacking incidents last year. Now, that's up nearly 25% from 2017. In all, more than 11 million patient records were affected. Anna Werner shows us how some of those records are being bought and then sold on the black market. That's not good. Anna, good morning.
No, it's not good, Gayle. In addition to your doctor's notes, your medical records can contain sensitive information like your date of birth, along with credit card and social security numbers. As healthcare providers store this information digitally, some have left their files vulnerable to being exposed. We spoke with a victim of medical identity theft who showed us just how much damage that can do.
It was quite a tumultuous decade of a mess.
The mess started in 2004 for Brandon Regan, when, as a young Marine, he lost his wallet. Months later,
your mother calls and she says what?
Local authorities were here looking for you today, regarding this incident.
Which was a
car theft, multiple car thefts at the time.
Someone posing as Regan was allegedly stealing cars and getting multiple medical procedures. Then the hospitals came after Regan to pay.
This is a collection agency who's sending a bill.
So this is the first one. So this one is, the balance says it's $2,236.
The bills added up to nearly $20,000.
You tried to get these problems off your credit report.
I did.
Did that work?
It worked until the next billing cycle.
So this was like a never-ending battle, and not the kind of battle that you in the Marine Corps are trained to handle.
Yes, ma'am.
But Gary Cantrell sees it all the time as head of investigations at the Health and Human Services Department's Office of Inspector General.
Every one of our investigations involves the use of medical data to commit this fraud.
He warns thieves want people's medical records.
It's just a treasure trove of all this information about you.
Last year alone, he says the agency handled nearly 400 reports of medical data breaches. Some of that information winds up for sale on the Internet's dark web.
Sometimes they're compromising this data, and we don't know how it's being used, when or if it will be used to compromise those individuals' identities.
So it's kind of sitting out there like a time bomb,
That's right.
potentially.
That's right.
So how easy is it for criminals to get hold of patients' files? We asked cybersecurity expert Gary Milievsky.
How long did it take us here to find medical records on the dark web?
Took me a few seconds.
Yeah, literally 3 seconds.
Yeah.
This seller offered children's health records for sale.
USA Kids full records from a pediatrician?
From the years 2000 to 2014.
Another posted an entire hospital's worth of files.
Healthcare database from Georgia, 397,000 patient records. It's a
397,000 patient records in a healthcare database is what they're selling.
Exactly.
So how are they getting the records?
Their quote-unquote product description says, breached a very large hospital recently.
Exactly.
So they're basically saying somebody hacked into this hospital and here's the records if you want to buy them for 26 grand.
Exactly. They want to monetize these records quickly, and they're actually offering them at a discount compared to other prices I've seen on the dark web.
Social security numbers sell for $1, and credit card info goes for up to $110. But Experian reports full medical records can command up to $1,000 because they're an identity thief's dream.
So I'm looking at the details, right? It says date of birth, place of birth, credit card details, social security number, your address, emails.
The 3-digit code on the back of the card?
Right. I mean, so this is really all they need if they buy this.
Exactly.
And then they can become
you.
And hackers have stolen millions of records. A breach at Anthem Insurance affected 78 million people, and a hack at UCLA Health exposed more than 4 million patient records. Despite that, a 2017 survey of healthcare providers found just 16% reported having a fully functional cybersecurity program.
One of our most important missions is to mitigate that vulnerability as quickly as possible, and that means communicating with those individuals who oversee the systems.
As for Brandon Regan, the crook who stole his identity served time in prison. But 15 years later, Regan says he still hasn't been able to undo all of the damage.
That hospital may still have his information, his blood type, under my name at that hospital, but
that's kind of worrisome.
It is a little weird to think.
Well, because of situations like that, experts we spoke with say it's a good idea to request a copy of your medical files now to clear up any confusion if your records are altered later due to medical identity theft, which is
A lot of information on the medical records I never thought about. Your 3-digit code is on your medical record?
And a lot of the
Thinking
onus is
about
on
that.
us, right?
as usual.
Yeah.
This is the thing, right? So if doctors and hospitals' offices don't have adequate security, they communicate with other entities in the medical world, then, they all have different security systems. There's potential for hacking.
And that's such a shame because having digital medical records has been such a benefit to so many people.
It's so convenient,
Yeah.
right? But it comes with the risk.
Until they steal your identity.
So many-
and then it's not
That ain't
convenient at all.
Well, Anna, thanks so much.